Well, this isn't pretty, but I wanted to do a side-by-side comparison. I've been struggling for probably the last 8 years, I think it's been, with a thing called vocal paresis. What that is that my left vocal cord does not come all the way over, so it gets tired. So your vocal cords bang together like when we're talking and when we're singing, and they create a seal like that. Well, mine don't, because the left one gets tired, and so the right one has to kind of come over, and it leaves a space in between, and that space has been causing me major problems. Vocal fatigue after like 2 or 3 songs, and certain notes that I have to kind of struggle to hit. I can't sustain notes, and so it's been a challenge. The good thing is that I'm going for an operation in another couple of weeks to get it fixed, or we'll see if it fixes it. But anyway, so what I wanted to do is a comparison just to see the difference between the two. So this is a song that I used to be able to sing really well, but it's challenging now. And so I'm going to play a little bit of it and then do the comparison. Come down off your throne and leave your body alone. Somebody must change. See that? You are the reason I've been waiting so long. Somebody holds the key. Ooh, but I can't find my way home. Hear the breathiness? You know I can't find my way home. So that was me before vocal surgery. And as I said, I'd been struggling with this vocal paresis thing for about 8 years, trying homeopathic concoctions, prescription drugs, and over-the-counter remedies, but nothing was working. As a professional voice user, I was speaking all day for my day job in television and as a professional singer. So my voice was very important to me. But no matter what I tried, it just felt like someone was wrapping their hands around my throat, and it took a lot of effort to produce a clean and controlled sound. I started going to ENT Allergy and Associates, seeing Dr. Richard Young in their White Plains office, who was the one who discovered that I had a paralyzed vocal cord. He prescribed some medications to help with the hoarseness, but my vocal cords weren't really responding. So Dr. Young referred me to Allison Ali for voice therapy to try and strengthen the cords through exercise.
Charlie came in with a left vocal fold paresis, which is essentially a weakness of the vocal fold. As they are muscles, it inhibited Charlie from using his voice appropriately and to the best of his ability. So what we did was we started with strengthening exercises to medialize the vocal folds together. Our next exercise is our V. You're just going to sustain the sound that a V makes. Lots of excess air in this exercise. You want that air. You kind of want to sound like a vacuum. Again, as long as you have the air. And at any point with these exercises, if the airflow lessens or stops, or your voice stops and starts again, cut out the exercise. We got a pretty good response, but not quite where Charlie wanted to be with his voice.
I was still getting hoarse and finding it hard to sing more than 2 or 3 songs in a row. So Dr. Young made me aware of a procedure that could help my situation. He referred me to Dr. Joe DiPietro, also of ENT Allergy and Associates in Sleepy Hollow, who offered a surgical procedure to correct the problem of a paralyzed vocal cord.
Charlie first came to see me back in the fall of 2017. He's a professional voice user and was noting a lot of issues with his projection as well as his vocal stamina. When we took a look here in the office, we did a stroboscopy exam, which helps us look at how the vocal folds actually vibrate. And we did notice that one side seemed to be a little bit weaker compared to the other side. For most folks, this wouldn't necessarily matter, but for him, because he uses his voice at such a high level, he was noticing significant symptoms. It's not unlike a marathon runner would notice some issues if they have difficulty with pronation or how their foot hits the ground on one side versus the other, whereas your everyday person might never really notice any issues with walking.
So I did the temporary procedure, and the reason they do it temporary first is just in case you don't like the way it sounds, then you don't have to live with it.
And what this did is effectively help move it over towards the midline so that the other side can meet it much easier.
While I was using the temporary implant, I noticed a huge difference in my vocal ability. My voice was stronger, and I felt I had more confidence and stamina singing.
Because the material itself is temporary and lasts about 6 months, ultimately, as the material went away, his symptoms came back. At that time, we decided to do a permanent procedure called a thyroplasty. And what that involves is I actually hand carve an implant based on how much we need to medialize or move over his vocal fold. And we do that while he's actually sedated but awake in the operating room. And during this procedure, we're actually testing his voice to see if we're getting better projection and a clearer voice as a result of what we're doing. And fortunately, we did. He did have some issues afterwards, and for that I sent him to my colleague Alison Ali again to work on a little bit of more of smoothing out the voice. Not unlike an orthopedic surgeon would send a patient who just had knee surgery to a physical therapist.
Vocal therapy is almost like physical therapy for any other muscle. They're just a lot smaller, so you continue to work on them and strengthen them. So the last two exercises I want to do with you today are our bulking up exercises, our strengthening exercises. They are solely there really to medialize those vocal folds as much as possible. The therapy we do does work more so with the speaking voice. For professional voice users, singers, we would like them to see a vocal coach who is more geared in the singing aspect of the voice. And so I suggested that Charlie go see a trained vocal coach. They had to tweak a little bit of how he was using his singing voice, kind of got into some bad habits when using it, and had to retrain a little bit for his voice to come through appropriately and in a healthy manner.
And this is where I really started to see the benefits of surgery by Dr. DiPietro and the vocal exercises with Allison.
Whatever the message is that you're trying to get across.
I went to see Dan Montez, a former international opera singer and vocal coach.
Hear that being supported through, and I think that,
Dan retaught me how to sing correctly by working on my breathing and vowel sounds, and it was here that I really started making progress. I didn't think I'd get there.
You did.
What note was that?
B flat.
B flat. B flat. How about that? Wow. So now I'm singing and speaking with strength and confidence, performing with a Van Morrison tribute band, and increasing my vocal range and stamina. So let's get back to a year ago when I sounded like this. To where I am today, and here's how that same song sounds.
Come down off your throne and leave your body alone. Somebody must change. You are the reason I've been waiting so long. Somebody holds the key. Well, I'm weary now, just ain't got the time. Whoa, and I'm wasted and I can't find my way home. But I can't find my way home. You know I can't find my way home. And I ain't done nothing wrong, but I can't find my way home.
So there it is. That's the difference, I guess, for me. Hopefully it's the same for you. I did this video because I really didn't find anything out there on YouTube when I was looking around trying to find something before my surgery. So hopefully this helps some of you get a better appreciation for what the differences are before and after, kind of a better before and after story. For me, it worked out great. If you're in the tri-state area, I strongly recommend that you check out ENT Allergy and Associates. Dr. DiPietro, Dr. Young, Allison Ali were great. They've got the technology, the experience, all the tools necessary to get you from point A to point B in my opinion, and the proof is in the process. So it worked well for me, and also to Dan Montez, my vocal coach, who really helped me relearn how to sing properly. That was a huge help for me as well. So anyway, good luck in your surgery if you decide to get it, and hope you come out on the other side better and stronger and happier than you've ever been.